So this is how we are going to do the blood gas, guys. You have to fill the sample here and it will aspirate. And you have to enter the patient's ID. For example, I don't know. We are here, guys, in our POCT room where our blood gas machine is located. This is our blood gas machine. It is ABL 800 basic. Blood gas machine is a machine that is used to determine the acid-base balance of the patient. And we have different samples for our blood gas. It could be capillary, arterial, or venous. So this blood gas machine is ready. As you can see, we have here the port to place our blood samples. If you are placing into this side, you have to use the syringe. And if you're using this side, you have to use the capillary tubes. This blood gas analyzer has different solutions. The Biomed is the one responsible to replace it if already empty. This is the waste receptacle. We can change this if already full. If we are doing the blood gas, we can determine the pH, the PCO2, the PO2, the total hemoglobin, the saturation of oxygen, and we can also determine the sodium, potassium, calcium, chloride, glucose of the patient. So this is very essential, especially if the patient is in ICU. Interventions can be based on this blood gas results. And all the data, you can check here all the data of the patient. If you misplace any result, you can go in the data logs and you can print it again. So in our unit, we have two blood gas machines, and both of them is functional. because most of our patients are critical. And we are always using this machine to determine the acid-base balance of the patient so that the doctor can intervene or can plan for any interventions for the patient. So this is how we are going to do the blood gas, guys. You have to fill the sample here and it will aspirate, and you have to enter the patient's ID. For example, I don't know the name of the patient, so I will write the bed. Then enter. Then you have to specify the sample, if the sample is papillary, venous, or arterial. Then after that, you have to remove the sample and wait for the result. This is one example of our blood gas results. In here, we can see the pH, the CO2, the PO2, the bicarb, the base excess, and also the saturation. Also, we can see here the hemoglobin of the patient, the lactate, the sodium, potassium, and chloride results. So, we're going to show this blood gas to our physician or to our doctors so they will be able to determine any interventions for our patients. Actually, this blood gas result is normal. The frequency of doing blood gas to the patient depends on our doctor's orders. For critically ill patients on mechanical ventilation, determination of blood gas is very essential because the parameters in the ventilator will depend on the results of the blood gas. After referring the results of the blood gas to the physician, don't forget to document any interventions given to your patients. Thank you for watching this video, guys. See you in my next vlog. Bye!